Hi there, my name is Nardine Elzahaby. I'm a CL Advanced Trainee at St Vincent's Hospital, Melbourne, and I work in the general CL setting. I'm also the chair-elect of the Trainee Representative Committee. The TRC reports to the College Board and provides formal representation for trainees within the college. It aims at improving the trainee experience and at addressing any issues that trainees may be going through. The coronavirus is changing the way we live, work, and communicate. The pandemic and the response measures, such as the restrictions on social gatherings, and large and growing financial losses, and changing messages from authorities, are among the major stressors that will no doubt contribute to widespread emotional distress and an increased risk for psychiatric illness associated with COVID-19. The uncertainty and prolonged crisis response will have significant impacts for Australians and may cause people stress and anxiety. This means a potential substantial escalation in the need for mental health services, a system that's already stretched and has been chronically understaffed. Many of us are also worried about being redeployed to assist with the pandemic response. We are aware that at any point we may be asked to work in a new or unfamiliar environment and with different patient groups. The AMA has clearly outlined that where this occurs, trainees must receive a proper induction and have adequate supervision. Clear clinical governance arrangements must be in place, including clear lines of reporting and access to senior medical staff for advice where there is a problem or a concern about the management of a patient. Where we are required to transition between different clinical areas beyond our usual scope of practice, employers should provide refresher courses and simulations for trainees to prepare them for these duties, including the appropriate use of PPE in unfamiliar situations. So please familiarize yourself with the AMA website. They also have a closed Facebook page where you can join for ongoing updates. Prioritizing our mental well-being is pivotal during these unprecedented times. This is a marathon, not a sprint. And self-care is part of looking after your community and your loved ones. Key updates to changes to training are provided by the college to help trainees during this time. So please familiarize yourself with the college's COVID-19 information hub and keep an eye out for the President's weekly updates. While many of us are worried about our progress in training, I would like to assure you that the overall response of the college is that of incredible support for trainees. Multiple sections and committees are advocating for trainees and suggesting potential solutions for the identified issues so far. I have found it particularly difficult to cope with the rapid changes in the middle of uncertainty. The structures we always had in place that protected us at work and on a personal level are no longer applicable. Some workplace dynamics which could have gone unnoticed are causing challenges at multiple levels at this stage. Also, as healthcare workers, we are regarded as frontline staff, such a huge responsibility that leaves us torn between our duty of care towards our patients and the community and our duty towards our families and loved ones, a time when actually each is heading in opposite directions. However, I found this is actually a good time to reorganize my priorities. I picked up an old hobby that I let go for many years. I've started playing piano again. I have also limited the time I spend on social media and news significantly. I have only been following the COVID-19 information available on the workplace intranet, on the AMA website, and on the college's website. I found that it's very easy to lose time doing various unimportant things. So I found it actually helpful to create a structure to my day scheduling regular exercise, daily meditation, catching up with friends via phone or online platforms. I know it's not the same. However, maintaining that healthy human connections during such times is very important to preserve our well-being. I have engaged in a reflective space at work, which has been great. There are multiple peer support groups set up through Facebook, such as Hand in Hand Facebook page. I have also been making an effort to stay positive and assume that people are doing the best they can. This is a skill that we rarely get taught, and it is very important at times of crises, where everything is imperfect. Please remember, this is unprecedented. We will all feel distressed, upset, and anxious at different points in time. It is okay not to be okay. Please reach out when you need help. Reaching out can make us feel vulnerable sometimes. The omnipotence entrenched in our profession can eat us away during such times. We need each other more than ever. Thank you.